To hear the full episode, become a patron at patreon.com/deathpanelpod.
The last year has been emblematic of what we could call a eugenic turn. You see it in pop culture.
Genes are passed down from parents to offspring, often determining traits like hair color, personality, and even eye color. My genes are blue.
Sydney Sweeney has great genes.
You see it in industry.
While the race for AI captures all of the headlines, there's another one quietly brewing between Silicon Valley executives. The race to create a bioengineered human being, a child. The Wall Street Journal has some extraordinary reporting out that a small company backed by none other than OpenAI chief Sam Altman has spent months pursuing a secret project for a genetically engineered baby.
I'm so excited today to announce the launch of Nucleus Embryo, a genetic optimization software that helps parents give their children the best possible start in life. This announcement also marks the first time a company has openly partnered with a couple to help them optimize their embryos based on intelligence.
You see it in the media.
They have given billions of dollars to mental health and the homeless population. A lot of them don't want to take the programs. A lot of them don't want to get the help that is necessary. You can't give them a choice. Either you take the resources that we're going to give you, or you decide that you're going to be locked up in jail. That's the way it has to be now.
Or involuntary lethal injection or something. Just kill them.
Yeah, Brian, why did it have to get to this point?
Right.
So you've probably seen these photos of skeletal kids in Gaza on front pages, all over social media, even in a UNICEF ad. They've become the symbols of famine. But we decided to look into these photos and the stories behind them. And what we found is that in case after case, these kids were sick, but not just with malnutrition. In every instance, they were suffering with other conditions or illnesses.
And you see it especially in the state.
And it is your patriotic duty, I'll say it again, the patriotic duty of all Americans to take care of themselves, because it's important for serving in the military, but it's also important because healthy people don't consume healthcare resources.
So when a legal alien goes to the emergency room, who's paying for it? The American taxpayer.
President Trump has promised to restore America's global strength and to restore the American dream, but he understands we can't be a strong nation when our people are so sick. A healthy person has 1,000 dreams. A sick person has only one.
A healthcare cost per person in this country is twice that of other developed nations. Why is it costing us so much? Because of chronic disease. And those chronic diseases, and we made it easy to be sick in America, are linked to poor lifestyle choices.
Let's say Social Security didn't send out their checks this month. My mother-in-law, who's 94, she wouldn't call and complain. She just wouldn't. She'd think something got messed up, and she'll get it next month. A fraudster always makes the loudest noise, screaming, yelling, and complaining.
HHS plans to bar hospitals and doctors from providing puberty blockers, hormone therapy, and surgeries as a condition of participating in Medicare and Medicaid.
Don't take Tylenol. Don't give Tylenol to the baby. Break it up, because it's too much liquid. Too many different things are going into that baby at too big a number. The size of this thing, when you look at it.
We are the sickest country in the world. That's why we have to fire people at CDC. And we are going to end the chronic disease epidemic, because it's chronic disease that is bankrupting us and destroying our national security.
Now, to be clear, this turn did not occur out of nowhere. Over the last few years on Death Panel, we've chronicled how a rhetoric of disposability has pervaded public life. And we've focused specifically on how the state response to the pandemic has acted as an accelerant to that shift. In everything from Paul Alexander, a science advisor to Trump's first term, urging a top health official in 2020 that, quote, infants, kids, teens, young people, young adults, middle-aged with no conditions, we want them infected, unquote, with COVID, to former CDC Director Rochelle Walensky at the height of the Omicron wave in January 2022, dismissing COVID deaths as only among, quote, people who were unwell to begin with. And part of the reason we were so quick to identify those aspects of the COVID response is because one of the main reasons we started Death Panel was to intervene in what we saw as, already before the pandemic, a deeply violent culture around health and disability that frames the ill as a financial burden to society and even as a threat to the human species itself. Throughout the 2010s, for example, some circles of academic health policy were focused on identifying so-called superutilizers, people with chronic illnesses or disabilities that tend to encounter the healthcare system more frequently than other people. A 2011 essay for The New Yorker by physician, writer, and later senior official at USAID, Atul Gawande, illustrated this idea of the quote-unquote superutilizer with a photograph of a man wrapped head to toe in bandages with a price tag hung around his neck, $3,500,000. This kind of pervasive rhetoric is what led BNI to write our book, Health Communism, which is about how these ideas, an economic valuation of life, are part and parcel to capitalism and capitalist societies, that health and ability being tied up in value and social worth are a key myth the state relies on to keep capitalism afloat. A fantasy of health that has always drawn its boundaries along lines of class, race, gender, madness, disability, and anything that the state decides is deviant in a particular moment, including political beliefs. And that this ideology has a very long, very dark history, one that, crucially, never went away, that we have throughout the history of capitalism only seen it expressed in different ways, sometimes dramatically, as in our collective understanding of Nazi eugenics programs, but often we have seen it more subtly. Which brings us back to today. If the COVID response has been an accelerant, the second Trump administration is where we have caught fire.
And so today's episode is about how we're rapidly falling into the dramatic end of health fascism and the role of the state in that shift. We're going to be looking at how the state's relationship to health is changing, why it matters, and what it means for political movements today.
To hear the full episode, become a patron at patreon.com/deathpanelpod. You'll get access to this and the rest of our catalog of patron-only episodes, and be the first to get a new patron episode every Monday when it drops. With love, the Death Panel.